Always have a garment such as a gown or t-shirt on under the orthosis with as few wrinkles as possible. No bare skin should come in contact with the orthosis. This will help to protect the skin as well as keep the orthosis clean. Start by helping the patient perform a partial log roll to tuck the gown behind them, then have them return to their back. Now perform a full log roll in the opposite direction. Grab the exposed gown and firmly pull up. At the same time, push the side panel under the hip as far as you can. Hold the posterior panel under the patient as they roll onto their back. Roll the patient in the opposite direction. Do not pull on the side panels. Grab the posterior panel and pull until the patient's spine is lined up with the spinal relief in the orthosis. Return the patient to supine. Now that the patient is on their back, place the anterior panel centered on the patient's body and low enough to contact pubis symphysis. Wrap the left panel down and around the hip and attach to the anterior panel, making sure to contain all abdominal tissue. Then wrap the right panel down and around the hip. Velcro it to the left panel. Tighten the TLSO by pulling the two pull tabs on either side of the orthosis at the same time. You will know it is tight enough when you can't pull the tabs any tighter. If the TLSO moves on the body, it is too loose. To properly support the fracture, the TLSO must be worn tight. If the patient indicates they cannot tolerate the tightness, then loosen the tabs by 1/4 inch. Secure the shoulder straps. They should be snug, but not so tight as to cause the orthosis to rise up. Do not have the patient sit straight up. It is best practice to have them roll to their side and then push to sitting. Have the patient lay down on their back. First, loosen the two pull tabs. Velcro the tabs on the side panels where they line up with the side of the trunk for ease of donning in the future. Next, unclip both shoulder straps. Unvelcro the right side panel with the logo. Detach the anterior panel from the left side panel. Decide which way you will roll the patient, then tuck the side panel under the same side as far as you can. Now log roll the patient fully onto their side. Continue to roll the patient until the side panel can be grabbed with both hands to remove. Do not pull on the back panel to remove. Once the TLSO is fully removed, have the patient log roll onto their back. Every time the TLSO is removed, reset the pulley system. Pull the side panels in opposite directions to stretch the pulley system out. Attach the Velcro back to the orthosis to prevent it from getting tangled and preserve the life of the Velcro.